Well, let's get right to it. We've got a few thousand leaders here in Silicon Valley, both business executives and community leaders on the line. And the first question is about where things stand in our country with this virus. As you know well, new cases are rising steadily across the country. We're at the 90,000 number, and a number of states have test positivity rates above 10%. Are we in the midst of a second wave? And are we as a country prepared, PPE, ICU capacity, et cetera, to manage?
Well, first of all, I think it's important to point out, and the terminology you used, are we going to go to a second wave? We never got out of the first wave. That's really the problem. So let me just very briefly explain why we are in such a precarious situation today. When we first got hit badly, it was dominated predominantly by what was going on in the New York metropolitan area, where in the spring, about 40% of the cases, as the hospitalizations and the deaths, were there. But as they came back down, we never got down to a real low baseline because the other areas of the country began to get hot, as it were, in the standpoint of cases. So our baseline, unlike Europe, which when they got hit badly, they came down to a very low baseline. Our baseline was about 20,000 new cases a day. Then we tried to, you might recall, Ahmad, open up the economy, as it were. And we had some guidelines that if followed strictly, I think the situation would have been a little bit different, but we were very disparate among different states and cities of how we did it. And as we tried to do that, we saw a resurgence of cases predominantly dominated by southern states, Florida, Georgia, Texas, Arizona, and Southern California, that went up to about 70,000 cases a day, which then came back down to 40,000 and stuck at 40 for a month or two. Now, fast forward to today, what you just described, we're seeing hotspots literally throughout the entire country, so that we're now averaging on a weekly basis about 70,000 cases a day, where more than 40 states are upticking with increases in cases, which will ultimately lead to increases in hospitalizations and then ultimately with increases in deaths. So we're breaking records for daily numbers of cases. Several months ago, I testified before a Senate committee, and I said, if we don't get control of this, we might get 100,000 cases a day. And I was blasted for that because they were saying I was being too alarmist. We're getting close to that right now. And one of the things that's of great concern to me is that as we enter into most regions of the country, into the cool months of the fall and the cold months of the winter, much of what is going to be done indoors. And indoors, when you have a respiratory disease, is a very problematic situation. So I'm concerned, unless we do something to turn this around, we're going to have a very difficult, very painful winter as we enter into those cold months. You know, just to finish by my first statement, there are 5 things that you can do without necessarily shutting the country down. No one has an appetite to shut the country down again. But if we have universal wearing of masks, physical distancing, avoiding congregate settings and crowds, and doing things more indoors versus outdoors and washing hands, we do not necessarily have to accept the inevitability of these major surges that we're seeing. Because if we do, as we get into November, December, and January, it's going to be a very, very difficult time in the United States.
Thank you, Dr. Fauci. You've outlined a precarious situation, and maybe to pivot, a positive pivot here with the vaccine. Where do things stand in terms of the realistic timeline for a vaccine?
Well, you're right. Let's pivot. I pivot for some sobering things that I told you to something that's relatively good news. So the federal government has been subsidizing either in the development of or the facilitation of the clinical trials of 6 separate vaccines, 5 of which right now are in advanced phase 3 clinical trial to determine efficacy as well as safety. 2 of them, 2 of the candidates of the 5 have gone into phase 3 trial on July 27th. They are having anywhere from 30,000 to 44,000 and up to 60,000 individual volunteers per trial. Right now, 2 of those trials are fully enrolled, the Moderna trial and the Pfizer trial, which means that we should be able to get an inkling of whether or not we have a safe and effective vaccine sometime in mid to end of November, beginning of December. I'm cautiously optimistic, although you can never guarantee when you're dealing with vaccine development, but I'm optimistic based on preliminary data from the phase 1 study that we will in fact have a safe and effective vaccine. I don't know how effective it's going to be. I hope it's going to be somewhere around 70 to 75%, but we won't know that until we complete the trial. If we are successful, we will be able to start administering vaccine doses by the end of this calendar year, or more likely in the beginning of 2021. And then the doses, and there will be hundreds of millions of doses being produced already, will gradually, in a graded fashion, get distributed to those who are in need of it over the subsequent 4, 5, 6 months, so that hopefully by the time we get to the 3rd quarter of 2021, we will have vaccinated the vast majority of people, provided people want to get vaccinated. That's one of the issues we're going to face. There's some skepticism about vaccines, which we have to overcome by outreach into the community.
Well, Dr. Fauci, let me ask you that question directly. And the polling data, which I'm sure you've seen here in California, about 2/3 of respondents, this was earlier this month, the Public Policy Institute of California, had concerns about the virus and that it was being rushed. And when we look at these numbers that show, certainly in California, a pretty high level of mistrust. And as you know well, there's a lot of information out there that's not accurate. How do you respond to those out there unwilling to trust our leaders on the vaccine? And I'll ask you a pointed question, because we trust you. Will you be an early vaccine recipient or make a definitive statement on the safety and efficacy of the vaccine when it's available?
Well, let me answer your last question first, Ahmad. The answer to that is absolutely yes. I will make a statement about that. And let me tell you why, I understand the skepticism that people have for a number of reasons. There have been some mixed signals and some issues that have come out of Washington that I think have not been the clearest.
You're very kind, Dr. Fauci.
Yeah. Yes, let's be somewhat discreet about this. So I understand that. So the way around that is to be completely transparent with the American public of what the process is in the decision of the determination of whether a vaccine is safe and effective, so that the American public will understand and appreciate and believe that this is something that will be for their own good and their own protection. So let me very briefly go through it. Every vaccine trial has attached to it what's called a Data and Safety Monitoring Board, a completely independent group of clinicians, vaccinologists, statisticians, and ethicists who look at the data. They are the only ones that have access to the data in a blinded fashion. They answer to no one. They don't answer to the president. They don't answer to the pharmaceutical company. They are part of the clinical trial process. Intermittently, they will look at the data and determine, should you continue the trial? You still haven't gotten enough information. Or they will look at the data and say, my goodness, it looks like the placebo is doing better than the vaccine. Maybe the vaccine is hurting you. Let's stop the study. Or hopefully they'll say, we now have enough data to say that the vaccine is safe and effective. Once they do that, they will then make the data public. I will see it as the director of the institute that is involved in the overall clinical trials. and the companies will see it. They will then examine the data. The career scientists, not the politicians, the career scientists of the FDA will look at the data, and another independent advisory committee called the VRBPAC committee will look at the data and advise the FDA as to whether grant this either emergency use authorization or an actual licensure. When they do that, Ahmed, it is totally public. I will see it, and all of my scientific colleagues will see it. So if anybody tries to do an end run about getting something approved before it's ready for the American public, that won't happen. I can promise you that. The process that's in place is independent of political manipulation. And I can tell you, apropos of your first question to me, I will be very open with the American public about my impression of whether or not this is safe and effective.
Thank you very much, Dr. Fauci. And you've mentioned multiple vaccines. Would different populations be better protected by one vaccine versus the other? And does that create further delays to the timeline that you just laid out?
Well, that's a good question. It is conceivable that some vaccines might be more effective in children or pregnant women versus adults versus elderly. We will find that out generally within a given trial because, for example, although because of safety issues, you want to wait before you put it into children and pregnant women, hopefully not wait too long. The clinical trials will tell us that. It really depends on about how effective the vaccine is that's the first one out of the gate. I mean, I hope and I believe that we will have more than one safe and effective vaccine. That being the case, the common question I get asked, someone will say, well, if a vaccine is proved to be effective, should I try and get it right now or maybe hold off and wait to see if you get a better one 2 or 3 months later? It depends on how effective it is and what your risk category is. If you're a very young, healthy, robust person, the chances of your getting into trouble with COVID-19 is relatively low. If you're someone with an underlying condition or an elderly person with an underlying condition, you might not want to wait. You might want to say, I'm going to get the first vaccine available because I'm in a risk group. So it really is going to be determining what your relative risk is.
Well, as the vaccine is developed, we've seen, and the president was treated very publicly with some of the new therapeutics and those advancements. What do we know about those at this stage, and how do those therapeutics dovetail with the provision of the vaccine, as you noted?
Well, absolutely important. Vaccines are to prevent infection, as you know, and the therapeutics that the president and others got is to treat someone who's already infected. We have some good treatments for advanced disease, and that's the reason why the death rates are going down, even though we're having a lot of new infections, because we know how better to treat people, and we have tools that have been proven in randomized placebo-controlled trials to be effective in diminishing the death rate. Now, what we really do need a lot more of, and there are many clinical trials that are aimed at getting information to prove or not the effectiveness of these drugs, are things that are given early. Like if you or I got infected and we had symptoms, what do we need to do to prevent us from having to go to the hospital or to prevent us from getting advanced serious disease that might require intensive care? There are a number of clinical trials looking at convalescent plasma, monoclonal antibodies, hyperimmune globulin, and a number of other interventions. So I would expect that in the next month or so, you're going to be seeing a number of more therapies, particularly those that can be given early in the course of disease.
Well, Dr. Fauci, before we move to our regional panel, I want to make sure to ask a question about you. I get real mad when people say things that aren't nice about you. And a lot of us, and a few thousand of the executives on the line feel the same way. So we've got your back here in Silicon Valley. But how do you do self-care in this pandemic? And what can our executives and community leaders learn from you about your routine and resiliency through what is an extremely trying time, certainly for you?
Well, first of all, thank you for your offer to cover my back. Every once in a while, I need that in addition to my wife, who's always there covering my back. Well, I don't think I should be an example, Ahmad, of how one should be taking care of themselves in this, because I'm in a very unusual position in that I'm running the institute that's responsible for the development of the vaccines and the therapies at the same time as being a member of the White House Coronavirus Task Force. So I have to say I haven't gotten a day off since January, which is not a healthy thing. Literally, I have not had a day off since January, and the hours are really grueling, but it's one of those things that I just say, and I don't mean this in a heroic way, it just is what it is. I just have to suck it up and say, this is a very unusual time. My time will come to kick up my heels and, have a beer or something, but right now it's not going to happen. There are just too many important things going on. So don't use me as a model for health.
Well, you've earned it. And now we'll go to our larger regional panel. Dr. Cody, Dr. Fenstersheib, thank you so much for joining us in this very important discussion. And I'll get right to it, talking about COVID here in California and what we've seen in terms of different approaches hyper-locally in the Bay Area with our counties and counties across our state. And Dr. Cody in particular, you've been a leader and out front here in Santa Clara County. Who's done it right or not? And how do we create more uniformity?
Thank you. And before I begin, I just want to say what an extraordinary privilege it is to be alongside Dr. Fauci. Dr. Fauci, thank you for coming to our region, albeit virtually. We hope one day you can come in person. I think one of the unique characteristics of California is that in state law, quite a bit of responsibility is given to local health officers. Every county in the state has a local health officer who is a physician and has the authority and the responsibility to make decisions to protect the population. Marty held that role before I did for many, many years, passed the baton to me, and then has come back to be at my side so we can do this together. But that has one in California, the health officers are a very connected group. We communicate with each other a lot. And we were all together really from the very beginning in January, trying to think through the risks to the population in our respective communities. So I think an advantage that we had in California was these relationships and these connections and this working together, as well as the law behind us to make decisions such as issuing the first shelter-in-place order in March. And I do think that early action enabled us to suppress the amount of community transmission early on. And our challenge since then is to keep community transmission as low as possible so that we can reopen gradually.
On the reopen question, and so many of us have young kids in school. My two boys are watching on Zoom this morning. Can we speak to the school reopenings? What is the data showing us? Has it been safe? Do kids need to be tested? And if so, how often?
Well, I think I also have children who are doing Zoom school, and I think this is an enormous challenge for all of us. I would say that here locally, actually one of our great priorities has been to be able to enable in-person learning for kids. We know that the distance learning has helped to magnify and accelerate educational inequities. However, we also know that there is great concern, rightly so, by teachers and staff about the risks of coming together for in-person learning. So our approach locally has been the following. One, to try to keep, again, the rates of community transmission as low as possible to enable reopenings, including schools. And the other is to provide guidance to our schools, both public and private. And we're thinking about it in a couple different ways. For younger children, we know that they like to be together and congregate. It might be a little bit harder to keep them apart and to keep them wearing masks. We do have guidelines that ask them to stay apart and be masked, but we also know how important it is that they remain in small, stable cohorts and really limit the mixing and do as much outside as they can inside. And certainly our California climate helps facilitate that. And then for older students, really important that they maintain a distance and wear their masks. It's much more difficult to maintain small cohorts. So that's our frame. We also have an extraordinary schools team in our Emergency Operations Center. We work with the schools and support them with advice and technical assistance and really whatever they need to help them do what they can to support their kids and transition to an in-person model as safely as possible.
And Dr. Fauci, on the schools question in our children, is there any additional data to comment on or information to share?
No, I think Dr. Cody really outlined what the optimal approach is. I mean, in general, across the country, and we have a large, diverse country, as you know, that have different levels of infection, which would really dictate the enthusiasm or not of various programs to get the kids back to school. The default position we feel should be as best as possible to get the children back to school, as opposed to making the default when you have infections, keep them out of school. But if you're going to make that decision to keep them in school or bring them back to school, you have to have a program that has a plan to respond, A, to what you're going to do if one or more of the children get infected, and two, what do you do to mitigate against their getting infected? And if you look at the country, we're divided into dark green, green, yellow, orange, and red zones. It depends on what zone you're in about what you really need to do. The one thing we do know that children can get infected and do get infected. There's multiple examples of that. They certainly statistically don't get as seriously ill or even ill at all to the extent that adults do. But some children can get seriously ill, and they certainly can transmit infection. Particularly children from 10 to 19 can transmit to adults as easily as adults can transmit to adults. So you've got to take infection in children seriously. Having said that, the program and the approach that Dr. Cody just outlined makes absolutely perfect sense to me as where you are right now in California.
Well, as a parent, that's wonderful to hear. And Dr. Fenstersheib, I'd like to bring you into the conversation as we talk about, we've got business leaders on the line. We want to see a reopen, certainly a smart reopen as soon as we possibly can. And can you speak to the balance between the very real economic considerations and fallout wrought by this pandemic versus preserving lives? I know there's a line.
Yeah, there's no question about that. And again, we've been focused mainly on the pandemic, preserving lives, but I think it's a balance. We have been working very hard in our community to bring down the infection rate and the positivity rate. And so when we get down to where we are now, which we are in this orange zone or orange tier in California, we are much more comfortable that opening businesses is safer. And we've been working with a risk reduction policy where we basically say, let's look at the activity, let's look at the business, and is it outside? Is it inside? Outside is always safer. Can you put on a mask? Can you separate yourself? So outside dining is certainly safer than inside dining, where you have to take off your mask. So I think basically we have been working with the community, working with the business community, and it's a struggle. It's a balance, but we can't open businesses until our infection rates is down as low as it is, which it is, and we want to keep it there. We don't want it to go up. We don't want to go backwards. Excuse me. we don't want to go backwards where we then would have to shut down businesses again. So it's a matter of being vigilant, being patient, and the community as a whole needs to be on board and work with everyone else. It's a community-wide issue, and we have to all work together to make everyone else safe.
And for our businesses reopening, should wearing masks and social distancing indoors provide a high degree of confidence that your chance, my chance, if I'm an employee coming in, of contracting COVID-19 is in fact remote?
Well, you know, nothing is remote, nothing is 100% in medicine, but for sure, using all of those precautions are very important. And the more we use, the better we are. Again, we put on a mask, we socially distance ourselves, we use proper hygiene, and in that way, we are safer. Again, when we start taking off our mask in a restaurant, for instance, we then have to look at issues around ventilation, how close the tables are. So I think it's a measured approach, looking at a lot of the factors and realizing that not one factor alone obviously is going to work, that it's a multiple list of factors that we have to put together, use as many as we can. And I should mention also, as we were talking about vaccines, we know that even with the vaccine, people are still going to have to be vigilant, still wear the mask, and still do all of the things that we have said until we really know that we have the protection in the community as a whole, which is probably going to take, as Dr. Fauci said, probably quite a long time.
Well, let me ask Dr. Fauci and Dr. Cody that question, the logistics of getting Americans vaccinated. What are the most significant logistical challenges that you anticipate, maybe Dr. Fauci for our country and Dr. Cody here locally in Silicon Valley?
Well, one of the logistic issues that clearly is right up front is that the candidates that are ahead right now, in the sense temporally, not necessarily the best, but at least temporally, that would likely be the ones that will be deployed sooner, is the cold chain issues. Namely, do you have local capabilities of maintaining the vaccine at the right temperature as you're waiting to distribute it? That's something that is being worked out now by logistics and supply chain people. In fact, you can't just assume that local clinics are going to be able to adequately and effectively administer it if they don't have the proper equipment and the proper training or what have you. And that's something that has to go on now if you're going to start deploying in January, February, and March. So that's just one of a number of issues that are logistic or technical that you have to address.
And that's exactly how we're needing to plan on the local level, to think that we don't know which vaccine it's going to be, but we need to plan in case it's one of these vaccines that requires freezing at very low temperatures. So at the local level, our job is the local logistics. So thinking about which vaccines it might be, what are the storage and handling requirements, do they need one dose or two? How far apart? It's a little different for each vaccine. And so locally, we want to plan for whatever comes to pass. We want to ensure that we can distribute it most efficiently to the priority groups when the vaccine comes into our hands. So we have those plans well underway.
So I would emphasize also that we also are aware that a lot of communities in our county, communities especially of color, are somewhat mistrusting of a lot of things that government does. And we're very concerned about getting the messages out about the safety, eventual safetiness of the vaccine. And that basically the people in these communities that are hardest hit will be able to take advantage of the vaccine and be assured and comfortable. And it's going to take communication and messages from the people that they trust in the community, their own doctors, the community leaders, to basically bring these messages so that we can accurately and effectively vaccinate those at highest risk.
Well, let's talk about that, Dr. Fenstersheib. And COVID-19 has been very, very hard for people of color, and it's disproportionately affected Black and Brown Americans. It's true in Silicon Valley and across California. What have we learned, And is there enough focus in your view on the systemic healthcare disparities that have exacerbated this pandemic?
That's a very important question. And in all aspects that we are working, we see the effect of the issues that the Black and Brown community have brought to us. Everything from testing and not really sure whether it's safe to be tested, not knowing or trusting what will happen if they're positive. Will they lose their job if they tell people that they were positive? Will they be comfortable again with the measures that we are asking them to take? In a lot of instances, communities of color are living in conditions that are crowded, and again, they can't isolate as well as we would like them. So again, it's been a working partnership with the community, making services available to them so that they can go and isolate or quarantine themselves in a safe location, that we have been able to provide assistance so that they can pay their rent, so that they can pay their food bills and feed their families. But again, as I said before, the messages need to come from within the community. So we have boots on the ground in parts of our community and in parts of our county that are most effective, so that those messages get to the people and provide the information they need to stay safe.
And Dr. Fauci, is there any additional perspective that you have to share or add to what Dr. Fenstersheib shared around the disproportionate impact that Black and Brown communities have felt throughout this crisis?
Well, there's a double whammy against the brown and Black communities by the virtue of the jobs that, as a demographic group that they generally have, they are more out on the front line, physically out interacting with people. So the incidence and the prevalence of infection among predominantly Latinx and African Americans is higher. Yet, when you look at the underlying comorbidities, which very strongly determine whether or not you're going to have a severe outcome of COVID-19, the disparity there is striking. Black and brown people have many, many more of the comorbidities from an incidence standpoint than the normal general population, including whites. For example, diabetes, hypertension, obesity, chronic lung disease, heart disease. So the rate of hospitalization per 100,000 persons, when you compare Black and brown people, which are at around somewhere between 375 and 380 per 100,000, compared to white, which is 82, that is a striking disparity. So what does that come down to? We've got to get Black and brown people vaccinated because they are among the most vulnerable. The only way we're going to convince them is what Marty just said about getting community people that they trust to get them to get vaccinated. But another way to do that is to get them enrolled in the vaccine trials so that when a vaccine is proven to be safe and effective, we can look the minority population in the eye and say, not only is it effective and safe in whites, we've proven that it's safe and effective in you because you've been a major participant in the clinical trial. So it's a two-step process. First, get them into the clinical trials so they can show it works in them, and then make sure they get vaccinated in the community level to prevent infection.
Can I jump in one more second and agree with Dr. Fauci? And also, we haven't talked about testing, but the frontline workers need to be tested. And we have been working very hard to have a very robust testing program in our community. We even have a health order requiring the large health providers to test all of the frontline workers when they make themselves available. And we would ask business to please allow your frontline workers to get tested, at least on a monthly basis, and to be able to stay home also if they become symptomatic.
Well, let's transition to the testing and the solutions discussion. And Dr. Cody, maybe I'll ask you, if you were the president of Silicon Valley, what would you ask our business leaders to focus on? Clearly, we have research and technology working to combat COVID. But when you're looking at where we are now and where we're going in terms of logistics management for a vaccine, what should our business leaders be focused on?
Thank you. First, I want to say that just to echo Dr. Fauci's words, there really has been a double whammy. So the communities that are most impacted are both feeling the pain of the economic situation as well as the pandemic. And I think that there are structural inequities that have really laid bare the inequities in certain communities. And so we're really at the forefront of research and technology here in Silicon Valley, but I think that the solutions needed are going to be those that address the underlying inequities. However, there are a number of, there are so many things that each and every one of us can do and the community can do to help. And just a couple of them to think about are, one, we have great visibility and granular detail about the health impacts of COVID on our community. We have great data on the non-COVID health impacts, but we don't have visible for the public so that we can see side by side what the other impacts are on the economics of the community. And I think it might be nice, just in the name of transparency, to be able to see that all together to integrate it. The other is back to our schools, and something that Marty mentioned and Dr. Fauci mentioned, all of the different prevention measures that we need to have, those layered prevention from wearing masks to keeping distance to ventilation to enable our schools to open for in-person learning. And maybe this is something that our businesses can help with to say, adopt a public school and help them think through how to improve ventilation. Many of the facilities are quite old, and this might be a partnership that would be helpful. I would also say that even here in Silicon Valley, our data management infrastructure for really critical public health surveillance data is not what it needs to be, not locally or statewide or even nationally. We excel at these sorts of things in Silicon Valley. So I know there have been partnerships, and I think more partnerships in the future for our basic public health infrastructure would be fantastic.
Well, Dr. Cody, that is a positive note to end on here. We have our marching orders. Thank you, Dr. Cody. Thank you, Dr. Fenstersheib, for all you're doing in our community. And Dr. Fauci, again, you're a true patriot. Thank you very, very much for making time to speak to leaders in Silicon Valley today.
Thank you. Thank you for having me. I appreciate you giving me the opportunity to work with you. Thank you.
Thank you.